Ladies and gentlemen, could I have your attention? Could I have your attention, please? I'm Andy Hamilton, the president of NYU, and you can see I've declared this in an optional event. This isn't an obligatory event, so I'm going to take my mask off for speaking and welcome all of you. There are so many reasons why today here at NYU's wonderful School of Global Public Health, there are so many reasons for this event to be truly joyous. Just having the event, just seeing a large group of NYU students, faculty, and staff all here together, celebrating success, celebrating new change, new developments, new facilities is such a joy. And we do have a great celebration today of this wonderful new space. This is a much anticipated ribbon cutting of our new space for NYU's newest school, its School of Global Public Health. And let me welcome all of you who are here today, faculty, administration, students, and honored guests, especially honored guests from the school's advisory board and the school's dean's council. Now, there are many things we celebrate today. One of them is the trajectory, the success, indeed the existence of our School of Global Public Health. Creating new schools in 200-year-old academic institutions is not an easy task, but that's what all of you have done these past years to create a fabulous, exciting, dynamic School of Global Public Health. And now we recognize and celebrate the new facilities, the new space that will be the home of our School of Global Public Health. And, isn't it ironic? We could have predicted that the schools move into this new space, a School of Public Health focused on how to tackle pandemics and public health challenges. Of course, the move into this space was delayed by nothing other than a pandemic. It was, I guess, inevitable, it was ironic, but it is also now coming to a close, allowing us to be, all of us, to be here today. And boy, was it worth waiting for. The entryway, the lobby, that spectacular green wall, that will become one of the great spaces at NYU, one of the great entryways into an academic site that we have. And this school has been on a remarkable trajectory these past few years. The pandemic didn't slow down the work of the faculty, students, and staff. You have all remained incredibly active during these past couple of years. And for us in the President's office, for Katie Fleming and her colleagues in the Provost's office, it's been a true delight to watch the successes that you've achieved. And enrollment, let me give you an example. Enrollment more than doubled in the school's first 4 years, from 2015 to 2019. It more than doubled, but then, not surprisingly, when the pandemic hit, applications to GPH soared. And this more than 114% in the 2 years from 2019 to 2021. The current class here at GPH is more than 1,000 students. Remarkable trajectory, a remarkable establishment of an academic, intellectual, educational community here. And you all know, I know you've been celebrating. As I walked through the front door downstairs, I was hit by those neon lights, reminding you all of the new US News and World Report rankings for global public health. And for this school, in such a short time, to rocket up to the top 10% of global public schools in the country, to rocket up, what are there, 195 odd schools of public health, and to rocket up to number 19 from number 31 in just a year, but of course the trajectory even before that is truly, truly remarkable. We know that strength in a school of public health, strength in any part of the university, yes, it's built on teaching, yes, it's built on the students who are attracted, it's also built on scholarship. It's also built on the creation of knowledge as well as the dissemination of knowledge through teaching. And so to see the progress and the productivity in GPH over these past few years in research. You are a small faculty, 54 members of the faculty. You submitted 129 proposals. So what's that? That's getting on for 2.5 proposals per faculty member on average last year alone. And that totaled $160 million, those proposals. And the school has now more than 100 active awards, many, many from the NIH and other sources, with an overall research budget of $60 million. The university-wide yesterday, for the first time, breached $1 billion spent on research. And GPH was an important part of that success. This is a dynamic, a powerhouse university. It's so gratifying for us to see the intellectual activity here, the creation of new centers. I'm thinking the Center for Anti-Racism, Social Justice, and Public Health. It was wonderful to see the celebration recently of the Li Ka-shing Family Foundation Initiative for Global Mental Health and Wellness. And that, of course, comes with support from the Li family, as well as, again, many federal agencies and federal grants. And these new initiatives join longer-standing centers and initiatives in areas such as bioethics, drug use, and HIV, HCV research, data science for social determinants, disaster science, implementation science, and methodology. These are really spectacular achievements, and the success of them, and I know the first person to say this would be your Dean, Cheryl Hilton, the success is due to you, the community. But I don't think there's a person in this room who doesn't recognize the critical role for the success of GPH that has been played by Cheryl Hilton. And I want publicly to thank her. There'll be other chances in the coming months to thank Cheryl more fully, but at an event like this, we are celebrating not just the school, but we're celebrating her leadership and the great achievements that have been made. She was determined that this would be something more than a new school of global public health. She was determined that she would lift, with your help, the school to great heights beyond that initially planned institute for public health. She stewarded and shepherded the small but truly mighty faculty into what we see today, a vibrant, highly regarded powerhouse. Getting the school established took a lot of legwork on Cheryl's part. She met with every stakeholder university-wide. She set the stage for the unanimous vote in favor of the school, which had to be achieved through the labyrinths of committees, including ultimately the NYU Board of Trustees. That was in 2015. She was hugely successful with that. And then, of course, came accreditation and the Accreditation Council, and she played a key role there as well. But critical now in this moment in the life and the history of the school is its home, a physical presence, a signature for the school. And this is what we celebrate today. And I'm very proud that one of my first acts early in 2016 as a newly minted president of NYU, one of my first acts was to approve the renovation plans for these 2 buildings that now comprise the School of Global Public Health. And we could not be more thrilled. Thank you to all of you, faculty, students, and staff. Thank you to you Cheryl, for the, and especially also the Wise Council. We have members here today and some on Zoom who are on the advisory board and the Dean's Council. Your wise advice has helped the school achieve everything it has achieved. There are videos everywhere in the lobby detailing the history of the school, the commitment of the school, its committed, deeply committed mission towards global engagement, towards making a difference in this world of public health. One of the ways in which you can tell the success of an academic institution, an academic school, is by how it transitions its leadership. You know, I would argue the standing, the reputation of a academic entity is established when it changes leadership. And so I couldn't be more thrilled that when we knew we had to search for a new dean, with Cheryl's announcement of her retirement, that building on the strength of her leadership and building on the strength of everything that you've all achieved, we were able to recruit a spectacular new dean. We could not be more pleased. Deborah Holden, she joins us from Michigan State University. She's here today. Any of you who haven't met Deborah yet, please go and introduce yourselves, talk about what you do at the school. And we are thrilled by the next phase in the history and the remarkable trajectory of this School of Global Public Health. So well done to you all. It's a great day to be cutting a ribbon, to be celebrating this new space. And it's a pleasure for me to hand the microphone over to the Provost of NYU, who's also played a very important role in the success of the school, and that's Katie Fleming. Katie.
Hello, everybody. It's wonderful to see you here. This is my first formal public post-COVID event. I know it's premature to say post-COVID, but it feels very good to be here in person. In any case, President Hamilton, as you know, is a scientist. He's dazzled you with all those numbers that he's thrown at you. I'm a humanist. I'm going to talk a little bit about feelings. And I feel phenomenal about this event because it has been a very, very long time coming. And a long, long time ago, when what you see around you today was but a glimmer in one's eye, the eye in which it was a glimmer was an eye shared, I might say, between me and Cheryl Hilton. Property in New York City is very hot. And as soon as we became aware of the fact at the university that there was not just incremental space, those are very magical words for the university, incremental space, but an entire building, you can imagine the feeding frenzy that began amongst people who thought that their need for the incremental space was the best and highest. And in our shared infinite wisdom, we knew that only one of those claimants was right. And that was the entity of which many of you here are a part and which we are here to celebrate. And it's really wonderful to have you here to celebrate with us. Now, when we were having those secretive conversations, what was then called the Global Institute, GIPH, in my email filing system, all the schools have their old names, so I can see the history of them right there in my Gmail. It was comprised of 6 administrative staff and a newly named director designate. It was a director at the time. It was located on Green and West 4th Street in 1,100 square feet of space, a nice size for a Manhattan apartment if you have maybe less than 2 children, but a very, very small amount of space indeed for what it was that we hoped to create. The school since then has grown at a truly dizzying pace, and it has relocated from Green Street to East 11th Street, then to number 665, then 715, then 719, 726 Broadway, and East 4th Street. And frankly, it's amazing you've gotten any work done at all. Now, GPH finally has arrived at, I have to say, ideal space, formed by twin buildings built in 1893 and 1896, respectively. At over 100,000 square feet, the new home, even for a humanist like me, I can tell you it's almost 100 times bigger than when the Institute first began. The school patiently waited to be consolidated under one roof, but I know that both faculty and staff will recognize that in this case, good things really did come to those who waited. And as President Hamilton described so well, GPH has grown from a small group of dedicated faculty and staff to a real world-class presence in public health, leading efforts to understand and address communicable and non-communicable diseases, disasters, the social determinants of health, implementation science, and substance abuse. And their work also takes them all over the world. People say that we throw the word global around a lot here at NYU, but it really, really is apt in this instance. In fact, even as we speak, 119 GPH staff are on the front lines in Ukraine addressing humanitarian needs with the school's nonprofit partner, Health Right International. We're thinking about them constantly and what a credit they are to our institution. And before I finish, I want to point something out. If you look at the front entrance of this building, you will see a picture of a water pump. Now, here's where one gets nervous when they're reading pre-written remarks. I've been told that if you look at the front entrance of this building, you will see a water pump, and I plan to do it on my way out. It's a depiction of a water pump on Broad Street in London, the same water pump identified by Dr. John Snow in 1854 as having been the source of England's 19th century cholera outbreak. And some of you may know that former U.S. Surgeon General David Satcher often instructs today's public health practitioners to ask themselves, where's the handle to the Broad Street pump, as a way to find the root cause of a new disease or malady. And I'm sure that this image is going to serve as a constant reminder to the GPH community that identifying the root source of a problem is often just as important as finding a solution. And that incredible GPH community is, of course, led by Dean Cheryl Healton, who will shortly be stepping down after a really extraordinary decade of hard work, very hard work, and huge progress here at NYU. And under the school's new dean, who has managed to match a face mask to an outfit, already clearing a hurdle that we at NYU have not really managed to clear for ourselves, I know that it is going to go on to even greater accomplishments worthy of the foundations, the tremendously strong foundations that Cheryl has laid. We really, really look forward to seeing what is accomplished in this beautiful new space, and we're delighted to be here to celebrate it with you. And now it is my immense pleasure to introduce the Dean of the School of Global Public Health, Dr. Cheryl Hilton.
What a beautiful crowd. Thank you so much, Provost Fleming, and thank you, Andy, for those very, very kind remarks. Both of you, as you know, were incredibly instrumental in what has been created here, and we are very, very, very grateful. I did jokingly send a photograph to Katie of all the keys I had been assigned to the various locations that she just rattled off, because I finally found them all. Anyone who knows me knows I keep a key for about 6 minutes, but I just moved apartments, and in doing so, I found all the keys. So what a momentous day and occasion, long anticipated by all of us, faculty, staff, students, alumni, advisory board, and dean council members, and of course, the NYU leadership, without whom today could never have become a reality. Our new home here on Broadway wouldn't have been possible without the architectural wizardry of Clement Halsbad, the creativity of Piscatello Design Center, NYU's Office of Construction and Management, our internal team at GPH for their extraordinary work over the past several years. Thank you, thank you, thank you. Some of you know that many schools of public health have been waiting many, many years to have a dedicated building. In our case, the real wait was actually to become a school. Should you tour our magnificent space today, you'll see a beautiful timeline spanning 80 years on our 8th floor, showcasing NYU and how it first began granting a master's degree back in 1971, as old as the Godfather movie, to give you some perspective. As such, this marks nearly 50 years between becoming a CEEF-accredited program in 1974 and actually becoming a CEEF-accredited school. Like a fine wine, it has aged very well. GPH's first U.S. News & World Report ranking landed us at number 37, and we were a program then and not an accredited school. Quickly, we rose to 31 among 188 schools in 2021, and just a few days ago, we were all blown away, I must say, when we learned that we ranked 19 of 195 schools, because this is a reputational survey that interviews 400 people across nearly 200 locations, and that means that we are well-liked, well-respected and well-liked, and I think you all deserve it. This means that within just 3 short years since accreditation, GPH is now in the top 20 ranked public health schools and programs in the nation, and this is an extraordinary achievement of which each and every one of you should be enormously proud. There are 2 significant reasons for your many achievements. GPH tries harder, and GPH, as everybody knows, has heart, a great deal of heart. We deeply appreciate what's at stake in public health, and this motivates all of us, faculty, students, staff, and all others who are drawn to our cause, to always go the extra mile. Many in the audience today understand we are at a turning point nationally, with an actual downturn in life expectancy due to opioid fatalities, a surge in alcohol-related deaths, and other loss of life linked directly and indirectly to the COVID-19 pandemic. We will need to further marshal our resources to combat these and other public health threats, many of which are, of course, substantially preventable. This extraordinary new space, our growing student body, our superb faculty and staff, together with our rising national and international stature, position us remarkably well to make our own unique contributions to ensuring the world is a safer, healthier, and more just place. As President Hamilton pointed out, we now not only have a new vibrant location as the fulcrum for our next chapter, we also have an energetic, extraordinarily talented new dean, Dr. Deborah Holden. And to finish the sentence, to lead us. She was kind enough to join us today at my invitation and to be part of this defining moment in our history. I know you will all join me in welcoming her very warmly. I did so last night at a 3.5-hour dinner. President Hamilton, Provost Fleming, and Dean-designate Holden, please join me in the ceremonial cutting of the ribbon, making GPH a new scholarly home for all the bright and ambitious public health students who grace our hallways now and those yet to come, all answering the call to save lives and help reinvent the public health paradigm.
Grab part of those scissors. I love the big scissors. I'm going to observe. So how many executives does he need? I'll allow me to position it. Is it one at a time, Julie, or both? Sam, say when.
Sam says when. When. Got it.
We are so grateful that you could join us today to make this moment in public health history here at NYU so memorable. I'd like to close by saying that it took a village to bring this building to life. It's been my privilege to lead this school in its formative years, but I had the help and support of too many people to name here. I am endlessly grateful to each and every one of them. To help underscore that sentiment, here are just a few of our faculty, staff, and students who helped build GPH.
We built GPH together by making sure that ethics is a central part of its curriculum.
We built the GPH research portfolio together by focusing on the most pressing public health issues here in New York City and around the world.
We built GPH together by fostering progressive partnerships in public health practice.
We built the school together by
growing the PhD program.
We build on the solid foundation laid down by previous directors and administrators.
We now work with 4 new concentration directors for enhancement of the programming and alignment within the departments.
We built GPH's undergraduate program together by collaborating with departments across the university, including 4 schools, 13 departments, and over 400 students.
We built GPH by giving diverse and talented people the opportunity to make a difference, not just in their own lives, but in the lives of many people in communities around the world who will be affected by their work over the course of their careers.
We built GPH together to cultivate a new generation of innovative leaders in public health practice who have the skills and vision needed to transform global health and promote health equity.
We built GPH together through rigorous biostatistical study designs and analytical methods, and their applications to important problems in public health and medicine.
We built this school together with our students, our faculty, our UN and government partners to address health challenges in the most vulnerable communities around the world.
We built GPH together by supporting our outstanding faculty and academic programs.
We built this school with the intent of being pioneers of public health at NYU.
We built GPH together by promoting the public health excellence of our stellar
faculty,
students, and staff. We built GPH
together
in response to
our students' calling
to create a healthier
and more just world.
Thank you. As we close, for those who are able to stay with us in person, please join a tour with some of the remarkable students and staff whose hands are now raised. People will raise their hands on cue, and to both those in the room, and to those who are in the room and watching online. Thank you so very much for joining us. I'd like to close. For joining us. That's it. I'm starting over again. Bye.